Welcome to our special Zoom edition of Conversations in Health tonight. Thanks for everybody for being so flexible as we switch. Of course, this is how regular life was a few years ago, but just as a reminder, I'm John Monahan. This is Conversations in Health, which is a course that we offer here at Georgetown every year. It's an opportunity for Georgetown students to engage with leaders in health across a wide variety of backgrounds and perspectives. And we're incredibly fortunate to have Dr. Stephanie Saki with us tonight as our first speaker of our spring series. Just as a for everyone, a reminder about the format. We'll start off. Dr. Saki and I'll start off with maybe 20 or 30 minutes of conversation to review her background, which includes time with us here at Georgetown University, and her career, and then maybe a few discussions. Since her work is so topical about what's going on here in Washington these days, and then we'll turn it to the class. The students enrolled in our class will get a chance to answer questions. For those of you who are not in the class but are part of the Georgetown community or joining us, if we have time, I'll entertain questions for Dr. Saki from you. We will try to finish our session, but sometime between 7:15 and 7:30. As I like to start each of these sessions over in the same place. I'd like to, before you get to Georgetown, before you've gotten to the amazing role you just came from the White House, could you just share with us sort of where you grew up and a little bit of your path before you ended up in Georgetown undergrad? That would be great.
Oh, okay. That's a real throwback, but let me try. So I grew up in Connecticut, in Greenwich, Connecticut, and Stamford, Connecticut. I went to Greenwich High School, and I mostly applied to Georgetown for undergrad because my older sister applied and didn't get in. And so I applied because it seemed like that must be a good idea if she applied there. And then I got in early action and decided to go to Georgetown. But so when I was in high school and growing up, even though I had many privileges and opportunities and experiences growing up, one thing I did not do very much of was travel internationally. And so the first kind of few opportunities that I had to travel internationally were actually through my church growing up. And I took a couple of trips to South and Central America through my church that were, service trips that I think a lot of churches do with high school kids in different parts of the country. And I just really enjoyed traveling and, enjoyed service and figuring out how I could do something to help, but, had a very sort of naive, simplified idea of saving the world and how I could sort of channel my energies and attention into saving the world based on those limited experiences. So when I applied to Georgetown, and I think even when I got there, I was considering being pre-med, and I
Okay.
was in the college
Right, right.
as a freshman. And then I think I won't go too far down the road, but I'll just briefly say that after my freshman year, during my freshman year, kind of realized, as interested as I was in medicine and biology, what I was really more interested in was public health. So I switched to the School of Foreign Service. There was no School of Health. There were no any number of minors and majors that you all mentioned. There was certainly no like public health,
Mhm.
humanitarian response, anything really other than diplomacy to focus on. So I had to I had a bit of a journey exploring that while I was at Georgetown, which I can share more about. But
Yeah.
I kind of made it up as I as I've gone along for most of my career, to be honest.
Well, and as everyone in the class knows from the first class when I told you my life story, I think you're going to see a theme throughout the course of the semester. A lot of the fascinating folks that we're going to hear from have made their journey along the way, not knowing their destination when they started. Though it's not uncommon, I would say, for people interested in health to start off with that initial interest in medicine, and science. I guess I would love to kind of probe one, were you always interested in science growing up, like in high school? Was that like something that you really loved? And then a little bit of maybe some of the discernment you went through when you decided, in addition to that, you decided maybe you didn't want to be a doctor, like what you could have done other things in the college, not going to foreign service. So I'd love to your thoughts as to how you got there.
I suppose I was interested in science, but I was especially interested in like health sciences, not so much
Sure.
chemistry, more, biology. And when I was in high school, one of the amazing things about Greenwich High School, which is a very large public high school, is that there's a whole range of classes. There were animal behavior class. I took an animal behavior class and I had pet rats that I brought home with me over vacation and tried to train. Actually, rats are very smart. They can be trained to do tricks. And I took a forensic science class. So I was interested in science intellectually, and then kind of combining that with wanting to do something helpful in the world and trying to figure out what my place was to do that.
Exciting. Well, then, so Georgetown turned out to be a good place to be. It sounds like, but
Yeah.
and so you did graduate from SFS, and then I guess I'd love, how did you, is a number of the people here are seniors, and
Mm.
hopefully everyone here will be a senior sometime in the next couple of years. Is one of the first big challenges is how to take those two impulses, one where you want to make a difference in the world, some set of interests in science, but there aren't usually a huge number of job listings in that space. But you really went through, you worked in a wide range of organizations. So maybe I'll ask you to kind of tell us, when you were at the end of your time at Georgetown, you were starting to look for work, how did you start to think about making your way in the world?
Yeah, I mean, I will also share, before even getting to the job part, because I had kind of a rough time my senior year at Georgetown. And I don't know if it's all structured the same way as it was then, but I was in the honors program, which had like grade requirements and then also a thesis requirement. And I mean, first of all, meeting the grade requirements senior year was not easy. I studied abroad my whole junior year, came back to senior year. There's a lot going on. So there was that challenge. But I also wrote my honors thesis on, this was in 2001, 2002. So this was before PEPFAR, which, as you all probably know, is a huge US government program to address HIV/AIDS. But I wrote my senior thesis on a human rights argument for the US government to address the AIDS crisis in Africa. And my thesis was very nearly not approved by the thesis committee because they told me that there's no such thing as a human rights argument for the US government to address AIDS in Africa. And that's not how human rights arguments work, because it's not the fault of the US government that this has happened. So this was a real conversation and struggle that I had to navigate when I was a senior. In retrospect, I've thought about it actually a lot, because when I was a senior in college, I felt like, wow, I completely misunderstood the coursework that I was taught in human rights and human rights doctrine. And it was embarrassing and, also stressful, because my family and friends were expecting that I was going to finish this honors program. And now I was having these conversations about, whether or not I had misunderstood the assignment. It ended up working out mostly because a faculty member pushed really hard to get my thesis approved. But it was a really challenging and important learning experience, which is that you go through not just school, but also jobs, and people who disagree with you for ideological reasons, political reasons, philosophical reasons, often present their perspective as if it is correct, rather than being just a different ideological, philosophical, or political perspective. And when I was in college, I thought, like, clearly they're right and I'm wrong because they're the faculty and I'm just a student. And, I think it's important to keep in mind that you actually might have a clearer view and vision of things and problems and what the solutions are than the faculty have. No offense, John.
No, no, it's I I hope everybody, well, if you're if you the world we're leaving, these students certainly wouldn't make them believe that we've got all the answers, right?
Well, that's true. No danger of that right now, for sure.
And well, I definitely want to probe this. I hadn't. So, where did you study abroad? Was that part of how you shaped your argument for the human rights case for the U.S. government becoming involved in HIV?
I think probably so. I studied abroad in Lyon, France for the my full junior year. And so I think it probably did in part because I mean, the way that France approaches conversations and dialogue about human rights is, similarly informed by ideology, politics,
Sure.
history in
Sure.
ways that are often not explicit, but presented as just very factual. And I think is different certainly then, but I think even now, maybe even more so now, is different from the way that culturally in the United States we talk about and think about human rights and international human rights. So I do think it probably informed, my understanding of like, of course, we have a moral responsibility to do something about this. That seems obvious. And, it seems consistent with what I just read about human rights. I mean, I don't mean to suggest, and you all are probably very familiar with human rights doctrine. I think there is a nuanced conversation to have about, what is captured in international human rights law and what are obligations of different countries. But I think the piece that was missing was understanding that there are just different interpretations of the same information, and no one is completely right or wrong. Everyone is sort of trying to figure it out, and I think that's still true now.
And it must have taken a lot of courage as a senior to push back and try to move. Were there like three faculty members on your panel? Is that how the,
I think so.
but
Yeah.
that's a lot.
Yeah.
Um,
Yeah.
so kudos to you. I mean, I just to state the obvious, and there's an entire world now that views the obligation of countries to, including the United States, to address HIV as a human rights issue. So that's really that's fascinating. How do you think? And of course, you've spent a lot of your career later on working on those issues, but before, so by the time you graduated, though, it seems like you then had a pretty clear sense or a clearer sense of an issue that at least you cared a lot about, that you were willing to push back on and get your degree, which is always a good thing. So how did that then that how that seems like then it would have really shaped how you thought about what you wanted to do after you got out of school.
Yeah. Yes, I was a senior the year of 9/11.
Yeah,
So that was 9/11 was September of my senior year. So that had a big impact on the job market, among many other things, in the United States when I graduated, and was just a very tough time for a lot of reasons, but a tough time to look for a job. But I had a clear idea of what I wanted to do, which was helpful. That's, step one. Step two, which is the harder step, is finding somebody to hire you to do what you want to do, which remains true now. So I actually waitressed full time at Sequoia in Georgetown, still
Yep.
there,
Yep.
for 6 months full time after I graduated while I was looking for jobs. I mean, I was applying to plenty of jobs, but just not getting hired and had to pay my rent. So I waitressed, which was genuinely the hardest job that I've ever had, including working at the White House, intellectually, physically, culturally, everything. And then I finally got an entry level job at an NGO, working on USAID funded educate girls education and public health programs.
That's great. And so, so then you went, actually, you worked for several NGOs then. So do you want to, I mean, one of the things, I guess I'd love your thoughts. You that was an era of rapid expansion in global health. I mean, despite the fact
Yeah.
that it was, the job market in the period right after 9/11 was really difficult. At the same time, it was the beginning of a period of sort of unprecedented expansion of global health, not just from US funding, but other countries. I guess just any reflections on those years, because you worked for two or three NGOs
Mhm.
in that first phase after school, right?
Yeah.
And I bet you've thought about that quite a bit over time, given where you've ended up.
Yeah. Yeah. I mean, it was an interesting time in some good ways and some not so good ways in terms of, I think the field has evolved in a positive direction since then. But it was then, PEPFAR was officially launched in 2003, and that was led to an influx of a huge amount of money into the global health space, obviously for HIV/AIDS, but even the girls' education projects that I worked on, a lot of them had PEPFAR funding. So they had, HIV prevention education components. So um, I think there was rapid expansion. There were a lot of people coming into this space and a lot of opportunities as a young person to just get thrown into the mix and really figure it out as I went. So one of the projects that I worked on in the first job I had for the first 4 years after I graduated from college, I started as an executive assistant to someone in a leadership role at the NGO. And after a year or so, I kind of got bored with that job and I went to her. I mean, I will say, first do the job very, very well for a year. And then I went to her and said, I'm kind of bored. I want to do more. I feel like I can contribute more. What else can I do? And because there was such growth happening in the field, it provided a real opportunity. And she basically said, okay, next week you're getting on a plane to Africa and you're going to 5 countries. And so I went to, I had again barely travel. I mean, at that point I had lived in France, but I hadn't been traveling the world for my life, as I imagine many of you have been. So I got on a plane with a couple colleagues and traveled and was gone for 6 weeks and went to DRC, Burundi, Eritrea, Ethiopia, not the easiest places to travel to, especially if you don't have a lot of experience traveling. Um, and it was it was an incredible learning experience. I also many, many times had the thought of, I have no idea what I'm doing. And I'm being given this enormous amount of responsibility. And, and you just can see the huge impact that these programs have the potential to have on people's lives. And when you see it with your own eyes, you also are reminded of the responsibility of, you're helping to design these programs, you're interfacing, with USAID. They were funding the work about, what they should and shouldn't fund and what's a good use of money, which partners to work with, what the needs are of children in different communities. It is an enormous responsibility, but I also was 24 years old. And, I just felt like I don't really know the answers to these questions. I mean, I'm, coming up with the best I can do from visiting schools and things like that, but there must be a better way to do this more effectively and at least make sure that if you're going to make recommendations, that you are making a recommendation to do something that really will be life-saving or open opportunities for people and not wasting money when you can see that there's a lot of need. So I think that experience, it was very eye-opening. I learned a lot, but it also, I think, led me to kind of the next part of my career.
Well, it's a good time to turn the ch so why don't you take us a little bit farther along, and I'd love to spend a little bit of time on your time at both HHS and at the White House. So,
Yeah.
but give us a little bit more of the journey, if you would.
So I was in that job for 4 years and then I applied to master's programs. I got my master's in science and public health from the Harvard School of Public Health. And then when I was there's a theme here of me being absolutely certain that I know what I'm doing next and then totally proven wrong shortly thereafter. So when I was getting my master's, I was certain that I did not want to, get a PhD and be in academia. So I finished my master's program not on the PhD track, and then I got a job at the National Institutes of Health out of my master's program. And then while I was at NIH, I applied to PhD programs because it turned out I was very interested actually in research. And I started a PhD. So I worked full time at NIH for a year, and then I started a PhD program at Johns Hopkins a year after that. I got a PhD in public health with a focus on demography and a lot of population reproductive health, a lot of statistics from Hopkins. And then when I finished there, I got a job at a sort of think tank research institute called the Population Council, which is based in New York, which was my dream job for the whole time I was getting a PhD program. I sent a lot of desperate emails to people working there to ask them to have coffee with me while I was getting my PhD. Many of them were very kind and did it. And I worked at the Population Council for 8 years after I got my PhD, starting from kind of an entry-level researcher. And then by the time I left, I was leading a research center that we had built that was focused on expanding opportunities for adolescents around the world.
And when did you have that's a very heavy quantitative role. I mean, you're working with stats, you're doing leading research projects. Was it your time at, when you're getting your master's and you realized that was something that you really loved doing, working with
Yeah, it
numbers
was.
doing research projects and
Yeah, it really was not until my master's program. I mean, I don't think I took a single math or statistics class in undergrad. I took some econ, which was required in SFS, and I enjoyed, but it was really during my master's program at Harvard. I just really enjoyed the statistics classes. I enjoyed, doing some of the analytical research work. I interned at Partners in Health with Harvard Medical School while I was there and did some data analyses for them. Yeah, but sometimes you can't, as much as you want to deny it, you can't deny things that kind of spark your excitement. And it turns out that statistics really sparked my excitement. So,
so you're a math person deep down.
it turns out
Just took
I was
okay,
an
that's great.
undercover math person, which also helped me get a job at NIH and helped me get into
Right.
the Hopkins PhD program. So it turned out well.
So when you built your own research program, did you I guess just how did those thoughts, kind of going back to your human rights ideas, did that give you a chance to kind of look in detail, or look at a level of analysis that you hadn't obviously before, but just did that give you kind of an insight into how to think about human rights issues and health in a different way, or was it a completely different track by then?
Yeah, no, it was. I mean, I think part of what appealed to me, not to come back to statistics, but part
Sure.
of what appealed to me about the statistics was, back to this question that I was really struggling with when I was in my 20s, on an airplane going to see all these different programs, which was, is this the right way to spend the money? And is this actually going to help people and change their lives and expand opportunities? Or is this just, for whatever reason, some idea that we have cooked up in a conference room in Washington, D.C. about what is best for this community that is completely disconnected to what is actually needed in this community? There's plenty of that happens. But I think part of what appealed to me about the statistics was doing, impact evaluations, causal analysis of what actually is effective if you have limited resources to expand opportunities for people. So a lot of the work that I did at the Population Council and the research center that I was leading was impact evaluations, causal analysis. We did a Campbell collaboration systematic review. I don't know if you guys know what that is, but it's very fun if you like statistics. just to look at, all the evidence that's out there. What does it show in terms of the best way to expand opportunities for adolescent girls? And part of what we were looking at, I was working on a girls' education program in my 20s. Part of what we were looking at is, are girls' education programs actually effective at expanding opportunities for adolescent girls? And if not, what are the other barriers that they're facing? Child marriage, lack of economic opportunity, other things. So it really was for me, trying to find a tool to answer this question that was haunting me of, there's a huge responsibility. There is a deep colonial history that underlies a lot of the development system. And especially back in the early 2000s, I think it's gotten a lot better with much more evaluation now, but in the early 2000s, there was a lot of people who, for whatever reason, were seen as experts who were Americans with limited experience in other countries, deciding, how money should be spent with limited quantitative or qualitative evidence, and then pushing millions of dollars based on those assumptions. I think the field has evolved. It's gotten better. But that was really what I like professionally and personally was pursuing, is like, is there a better way to do this?
That's certainly your reputation certainly was as somebody who brought rigor and analysis. Now I have a little bit of a sense of the history of it, so that's great. No, that's great. So how about we transition now a little bit to your time in the Biden administration, particularly at HHS, and the role you played at in the White House. I think that and then maybe we'll take a minute to reflect on the last few weeks, but
Sure.
why don't you give us a little bit of a sense of because those you had really two quite different roles, the
Yeah.
HHS role and the role you came into at the White House. So
Yeah. Yeah, so I think, as was the case for many people, the COVID pandemic um just led me to consider working in government, which is not something I'd really considered before, because obviously it was an unprecedented global health crisis. It was the field I've been working in, and I wanted to find a way to be helpful. So I through a fairly opaque process that still I'm not quite clear, although John, you probably know more about how the transition process works. I ended up with a very specific opportunity
right.
to apply to a job at HHS, at the Department of Health and Human Services, in the Office of Global Affairs, which is basically the office at HHS that does all of the international work. So HHS primarily focuses on domestic health within the US, but the Secretary of Health and Human Services interfaces with ministers of health around the world, including through the World Health Organization. So I had an opportunity to take a role as a senior advisor for gender and health equity in that office, which I took. I mean, there weren't other options presented to me, but I was excited to take that one.
We were excited.
I was excited. But I really, I had never been in government. It was completely a new experience to me. So I was there for 18 months, and again, a lot of sort of representing our Ministry of Health with ministries of health around the world, including through WHO. I was there for 18 months, and then I was asked to go to the National Security Council at the White House for what was originally supposed to be a 90-day detail for some sort surge support to oversee the global health portfolio. But it turned into a 2.5 year detail, where I
Could you tell people this detail means what?
Oh, detail means that I still was an HHS staff member. They paid my salary and everything, but they shared me, whether they wanted to or not, with the White House. And most of the people who work at the National Security Council are detailed from different departments and agencies across the US government, which is actually a really interesting model, because then you have people who deeply understand and know the different parts of the government working together to try to find solutions. So I was technically still an HHS staff member, but working at the National Security Council for the last 2.5 years of the administration. And then after I was in the global health role for a year, I moved over to the team at NSC that worked on health security and biodefense. And I was appointed by President Biden to serve as the first ever US coordinator for global health security, which was a role created by Congress in 2022 to basically be the belly button at the White House and make sure that something like COVID doesn't happen again when there's a biological threat emerging in the rest of the world that poses a national security threat to the United States, that there is someone at the White House to quickly coordinate a response to contain and mitigate the threat to Americans. So that's what I was doing until about 3 weeks ago.
And so, just if you could say a sentence on the role that the National Security Council plays in the White House, and then if an event, a big part of your life was tracking things that could become the next COVID or something scary, could you maybe just walk us through a little bit about what the NSC is and what you would do if something scary emerged? Because the world is filled with scary things. We have
Yeah,
H5N1 going on now. Just maybe if you could help us understand a little bit about
yeah.
the big responsibility you had to identify and convene.
So the National Security Council and the other councils at the White House work similarly, especially the Domestic Policy Council. But the National Security Council basically coordinates federal departments and agencies to develop policy. So what that means is that the people who are at the National Security Council, like I was not coming up with the policy. We had directives from President Biden and from leadership at the White House about what the goals were for the administration. And then our job was to bring together all of the departments and agencies. So the State Department, HHS, USAID, the Department of Homeland Security, Department of Commerce. There are many, many departments and agencies that we would work with to bring them together, actually physically bring them together in meetings. But also, we have a very structured decision-making process at the National Security Council to develop policy that they will then implement. So, for example, the president early on in the administration, there were a series of executive orders focused on addressing the COVID pandemic in the rest of the world and building out our global health security work. And then our job at the National Security Council is to take that directive from the president and work with the departments and agencies to make sure that they implement it.
Excellent. And one of the things you produced at the very end, which is one of the readings folks had here, was the U.S. Global Health Security Strategy. And so maybe I'll make this my last big question here. So I'll just put Lily on notice that you'll be the first person when we move to the next. But tell me a little, that was a major product. And that wasn't just responding and making sure that you're implementing policy, but it was trying to articulate a broad agenda for the country. I guess I'd love your thoughts as one about that experience of doing that, but also, and I know you did it with many other people, but just for everyone else on this call, there's always one person that makes these documents come together. And Stephanie was that one person for this major strategy document. So I guess your thought on where are we now? How do you feel about what's in the strategy, and how do you feel it articulated what we need to do as a government and a country to be ready?
Yeah, I mean, I think what we tried to do, so I should say first that there was a global health security strategy that the first Trump administration released in 2019. Our strategy was not that different from the 2019 strategy. President Trump has asked his administration to revoke, rescind, revise, release a new global health security strategy. So hopefully it will again be fairly similar to what we've done over the last decade. We will see. But I think part of what we tried to do was lay out just what are the levers that we have available to us through the US government to improve global health security. So bilateral programs, the way that we invest, country by country and building up their capacity was one pillar of it. Multilateral programs, obviously our partnerships with WHO, but also regional institutions and the financing space, which is, a big space where there's a need for improvement and progress over the next few years, but one where we spent a lot of effort to just fill some of the financing gaps. And then linking the work that we were doing in global health security to some of the other national security priorities of the United States. So basically, there was a certain approach that the Biden-Harris administration had to those levers. We, vastly expanded our bilateral partnerships. We tried to build out more sustainable sources of financing. that is not necessarily the approach that every administration is going to take, but I do think that the tools available to you, kind of the toolkit, is the same. And then how you vary the use of those tools is probably going to depend on the policies of different administrations. So I am hopeful. I think prevention is better than responding to outbreaks. So I'm hopeful that the US will continue to invest in prevention, although the last few weeks probably don't bode well on that front.
Well, I kind of lied when I said it was my last question. I can't help but want to ask you about, the really shocking series of events that occurred at USAID and really across the government. I mean, a strategy is only as good as the capacity of the agencies and the programs that they're running. I guess I'd love any reflections you had before I turn it over to Lily on how do you feel, regardless of the particulars of a strategy. And you say obviously people can adjust things, but capacity is really important. And I guess I'd love any reflections you have on what we've seen the last few
Yeah.
weeks.
Yes, I mean, there's a lot to say, I think, across the entire development and global health space. And I think the way that um, each of those areas survive or don't survive, it's probably going to vary a bit depending on, the topic and the political support for those topics and the response to the actions taken. But in the global health security space, I think that there has been more bipartisan support because it is easier intuitively to tie it to national security. I think it's easy for people to understand how, especially people who remember the West Africa Ebola outbreak in 2016, it's easy for them to understand how this poses a national security threat to the United States and how it potentially affects the lives of Americans. Everyone just lived through COVID. So I think it's easier to make that direct case. The question is whether the Trump administration believes that it is worthwhile to make investments to prevent outbreaks from happening and help countries prepare for outbreaks to happen, or if the posture will be, we will wait for a crisis to happen and then just do everything we can to keep the crisis out of the United States. My argument would be one, it's less expensive to invest in prevention upfront. I think we saw the impact of COVID, which continues to have ramifications globally. But also, you're not always able to keep a crisis out of the United States and to mitigate the effects on national security. So I think it's a very risky approach if they choose that path. But they did just appoint someone to be the director of the Office of Pandemic Preparedness and Response at the White House, who has a very strong background in this area and I think is perfectly capable of serving that role effectively and is tasked with revising the global health security strategy. So I'm keeping an optimistic, open mind for now on the global health security front. I think the situation is much more dire in some of the other areas.
I couldn't agree with you more. But let me turn this. So, Lily, I'm going to open it up now to you. So, just so everyone's aware of the queue, Lily and Delaney, Shristi, and Bailey. So it'll be in that order, and then we'll. So, Lily, you want to kick us off?
Sounds good. First of all, thank you so much. It was great to hear all of your insights. And I know really exciting. I'm a senior myself, so it's helpful to hear about that part of your life as well. I guess I had a couple of questions, but the one that I'll ask and start with is, as many of us are sort of considering the different avenues by which we could make a difference in the world and combine that with our interests. You've worked for nonprofits, for NGOs, you've worked in scientific research, and now more recently in government. And I was wondering if you could go into a little more detail on sort of the strengths and challenges of being able to make change and how that looks different in those different sectors. Yeah.
Yeah. So I will say in the nonprofit and research world, one of the main dominating forces of your existence is fundraising. And you have to have a skill set to do it and an appetite to do it, and comfort with the uncertainty and pressure of fundraising to survive and excel in those worlds. So I think that that is part of the reality. And obviously, at least in terms of where we are in this moment, there's a lot of uncertainty about, what the sources of funding will be in both of those spaces. And I think there will be just kind of some, I don't know, right sizing or something of the space based on where we land with the resources. But I think that's a big part of the reality of those spaces. I will say one of the big benefits, though, of both of those pieces is that you have the luxury of doing a deep dive and developing expertise and really exploring and pursuing areas and issues that you're interested in, but also that you think are important and valuable. And you can really build out a career in an area of study and work in whatever topics you choose. I think in government, you don't have to worry about fundraising. I mean, you do if you're the president, and you do have to get money from Congress, but it's not a day-to-day part of your reality for the most part. You also, and this is, I think it depends very much. There are a lot of different things you can do in government, but certainly at the White House, you don't have the luxury to really spend more than 30 seconds on anything because you're just in a constant state of moving from one crisis to another. And it means that there's, I had a lot of reflections over the last few years of just like, this entire system is completely broken and someone really needs to spend some time reflecting on that and finding a better way to do it. But I don't have time for that. So I will just try to make it work in this system. So I actually think, trying to imagine a career where you go back and forth between different spaces, and I haven't worked in the private sector, but I think there's also a lot to learn in the private sector, is probably the ideal. And people are doing that more and more now. So you don't have to be locked into any one of these areas.
Thank you so much.
That's great. Delaney?
Hi, same thing. It's great to hear your journey to where you are. So I definitely was curious with how administration transfers kind of change the goals in a position like coordinating global health security. Is there any way to like create policy changes that are more like proactive, or like would you say that like your job changed from November to January of like compiling your guys' strategies, sending it on to the next administration?
Yeah. I would say that the job changed for sure. I mean, in one sense, you suddenly lose a lot of authority from the White House when your party loses the election because, for reasons that are obvious. But I think most of the staff in the U.S. government are career civil servants who don't, have a political allegiance. They're not working, just to pursue the interests of a political party. They're working on behalf of the United States. And when when an election happens, they're anticipating and preparing for the changes in policies that are coming. So it becomes very difficult to make a lot of progress. And also, to be fair, I think, when an election happens, the American people have spoken about, which party's priorities they want to see reflected. And it's not really the time to be trying to, shove through a bunch of policies that are not the ones that the American people just voted for. But I will say, from a national security perspective, a lot of what we were very, very focused on from November to January was just having a smooth transition and making sure that we didn't in any way expose, it's a high risk time for any country, but for the United States in particular, when you have a transition of power. And so our preparations were very focused on briefing the incoming administration, putting together materials, documenting what the lessons that we had learned and the practices that we found to be useful so that we could make sure that the career staff have them in hand in case there was a crisis, especially early on, but also that we could hand them over to the incoming administration. So we handed over a playbook for response to biological threats, a physical playbook to the incoming administration at the White House, and made sure that the departments and agencies had it in hand so that if, at 1 p.m. on January 20th, there was a biological threat that emerged, there were many people across the government that would know what to do. So that was really our focus.
Great question. I've been involved in a few transitions myself, and these especially the work you're doing, it's really, really important for the handoff to go well. So thank you. Shristi, I think you're up next.
Hi, thank you again so much for being here. I know you touched on this a little bit earlier, but I was curious to hear a little bit more about in what ways the U.S. global health security policy that you had put out was successful and what obstacles were presented, especially with the changing of the administration and what that kind of meant for the policy.
Yeah. I think that what we are facing right now is that a lot of the way that we certainly pursue our global health goals, but a big part of our diplomacy and engagement in the world is built off of the investments and the partnerships that we build around the world. So our strategy, as I mentioned, a big pillar of our strategy is these bilateral partnerships with countries that require actually a relatively small investment. Sometimes it was just $5 million, which is a pretty small investment for the US government, to work in partnership on filling global health security gaps. I think the challenge, in this moment is, and this is, on some level, a conversation worth having, is what are the other pieces of a global health security strategy that are not dependent on the US government handing over resources to other countries? I think it is, a lot of our strategies are partially dependent on resources. So I think it's really difficult probably right now for people who are working on global health security with uncertainty about what foreign assistance programs will look like and what resources are available to think about how to implement the strategy. That said, even aside from, some of the decisions that are being made by the current administration, we were very focused on sustainable financing models, just pushing very hard throughout the Biden-Harris administration. The fact that the same set of, 6 or 7 donor countries cannot sustainably be funding health systems in the rest of the world. So there has to be a different approach that we're coming up to. We have to think about transitions of, things like paying health worker salaries, having those expenses taken on by ministries of health in countries around the world who are not currently consistently paying health worker salaries. And so I think our model was very much about building capacity to make sure that we get to a place where we can fully hand over financial responsibility and leadership responsibility to countries to contain biological threats. We're just not there yet with most countries around the world. So I think this is a real challenge that the current administration will face if they think about scaling down that funding.
Great. Bailey?
Hi, thank you so much for joining us again, Dr. Saki. It's always nice to hear from a fellow Hoya. I was also sort of curious about the sort of move to bilateralism in the strategy that your team put together, but more so in the sense of the context of like multilateral moves. So I was curious specifically, like what reasoning was underlying wanting to sort of develop those relationships rather than pursue existing ones through like the G7 or the G20 or who instead.
Yeah. It's a good big question about how these different pieces fit together. I would say that we pursued all of these things. I think, in terms of funding, there is a reality that you have a lot more control over the bilateral funding than the multilateral funding. So when we're making the case to Congress and, more directly to the American people for funding, I think there's an interest in just knowing exactly what it's going to and making sure it's going to priorities that are priorities for the United States, because it's, of course, taxpayer money. So I think there is certainly, well, I don't want to speak for everyone in Congress, but I think there is often a preference from Congress's perspective to focus on bilateral funding for that reason. You just have more control over where it goes. I think however, the multilateral diplomacy part of it was also an important part of our strategy. I think through the G7 and G20, we did a lot of work to push some of these priorities, including the ones in the Global Health Security Strategy. So just as an example, the Development Finance Corporation, which is an agency created by the first Trump administration, it launched a G7-wide initiative with all of the development finance institutions to make sure that there is surge financing in place early on in a health emergency. So in other words, this was one of the problems that we faced during COVID. There was an emergency, there was not a lot of access to capital very quickly. So if countries wanted to procure vaccines, for example, if they didn't have capital available to them, they had to get in line behind all of the high-income countries who did have capital available. So DFC and their counterparts and the rest of the G7 started this initiative to basically make capital available to low and middle income countries so that they could get in line to procure the medical countermeasures they need to procure in times of emergencies. So I think there were a lot of really interesting multilateral partnerships that we pursued to try to advance the objectives that are in the Global Health Security Strategy as well.
All right, let me open this up. I think the best way to do this is if you wouldn't mind using the raise hand signal. That way we'll be able to call on people of the next round of questions here. Well, oh, here we go. Margaret, do you want to jump in?
Yeah. So it's kind of along the lines of Shristi's question. So you sort of talked about the goal is ultimately to hand over financial responsibility and have like a independent, public health system. So and you also mentioned like blind spots in the US trying to just sort of finance or transplant the same system we have. Like, do you have any sort of specific stories or examples about those kinds of blind spots and like that why that kind of fails?
I think, I mean, we're in a very interesting moment that I wish we were not in, but is going to be very revealing in terms of which financing gaps countries fill that the US is about to leave open. So I think we will learn a lot from that. But to give the example of PEPFAR, because PEPFAR has been, a theme throughout this conversation. So it was initially launched in the George W. Bush administration in 2003, had its 20-year anniversary a couple of years ago, and for the first time did not have bipartisan support for reauthorization. And I think there are a lot of reasons that has unfolded, but one of the concerns that I think has been raised, which is fair, is it's a huge amount of money. It's about $4.5 billion a year from the US government. And the question is, what is the pathway to get from where we are with $4.5 billion a year to winding down PEPFAR after 2030, at least because that's what the Sustainable Development Goal is in terms of hitting the target for HIV/AIDS. So kind of this can't be sustained forever. It's a huge investment from the US government that's been ongoing for 20 years. What's the plan to get to handing off these costs? And I think there has been an ongoing conversation with each of the PEPFAR recipient countries, but there is a reality that the cost in particular of procuring antiretroviral drugs is very high. And it's very difficult for many of the countries that participate in PEPFAR to think about taking on those costs long term. So you're stuck in this situation where on the one hand, we say this is not a sustainable model, we have to hand over ownership. On the other hand, there's not really a feasible kind of plan to get from where we are to where we need to be. I think what we'll see in this moment, hopefully PEPFAR will continue, or a good portion of PEPFAR will continue, but I think what we might see in this moment is our country is going to be more willing to pick up things like the cost of covering the salaries of health workers with an agreement that the United States, Global Fund, and others will continue to procure and distribute some of these drugs that are very expensive. But there's just not an easy solution. It's not simple. If it were, I think the many, many people working on these issues would have sorted this out a long time ago.
Let's see. Oh, Kaylin.
Hi, thank you for giving your talk and just telling us a little bit about your Georgetown story. Something I'm personally really interested in has been the intersection between health and the environment. Would you mind talking a little bit about One Health and the US government strategy and also some implementation challenges we may face with these approaches?
Yeah, and this is a great questions. I feel like we could spend hours on each of these. So, I think both in terms of One Health, but also in terms of the connected but not exactly overlapping conversation about climate and health. One of the challenges is that there, at least in the previous administration, I think we're in a different moment now, but in the previous administration, there was a lot of sort of agreement, declaration, strategies, offices, funding, et cetera, that we are focused on. We embrace One Health. We need to have a One Health approach. We need to look at the intersections between climate and health. And this is not just in the United States. This is also globally a lot of discussions at WHO with other countries, with WOA about these issues. And less, especially in the climate and health conversation, but less concrete solutions in terms of what this actually means we should do differently from what we are doing right now, and then policy commitments and action to get there. So in the a lot of the discussion in the climate and health space is about adaptation and early warning systems and how we make sure that populations are prepared for extreme weather events, for example, that might cause flooding and outbreaks. I think the part of what we reflected on quite a bit is you can have an early warning system, but if you don't have a policy or a response that is going to be triggered by that early warning system, then you are just describing a crisis while it happens. You're not actually preventing or responding to the crisis. So how do we link these things up? The description of the problem, the monitoring of the problem, the system to tell us when the problem is going to happen with an actual more effective response. And I think that goes back to what I was saying before about who's making the investments, who has the financial capacity to make those investments, and how do you get from limited capacity to a place where countries can operate independently in a world where the threats are growing every day. In the One Health space, we obviously have been grappling with H5 in the United States, but there are a number of zoonotic threats around the world. Marburg in Tanzania, right now, Ebola in Uganda. I think one of the challenges is that the incentives in terms of animal health and human health are not always fully aligned. And so I think decision making about, especially in context of limited resources, but this is also a challenge in the United States, clearly, decision making about, when the tipping point is when you prioritize a potential risk to human health over an immediate risk to animal health, what that turning point is, I think is really difficult. And it's different actors, different agencies in the US government, different actors globally, different decision makers who represent those interests. So I think in principle, there's an agreement that we all need to work together. We need to have a unified strategy and approach, but in practice, sometimes the decisions and the interests of those spaces are in conflict. And that, I think, is just a reality we have to acknowledge and navigate.
Maybe, can I just ask a follow-up there that goes to the role that you played at the NSC? Because H5N1, beyond just sort of the scary potential of this kind of influenza, is really, it's widespread in the United States, and you're thinking of national security sort of threats from without, but of course you're partnering with public health agencies in the United States. And I guess I'd love, how did your office or your role intersect with our domestic agricultural regulations and our public health strategy, and frankly, your counterparts in other countries who probably are worried about H5N1 coming from the United States to their countries, right? Is that, I guess I'd be fascinated to see how you sort of walk that space. And I just, partly it's from personal, and H1N1 15 years ago, the first cases that were characterized ended up being in the United States, right? So it was, I mean, we were both working in the rest of the world, but also trying to characterize it domestically and trying to figure out what to do. So I'd love how that must have put some tension in the role that you were navigating.
Yeah, so I think luckily for me, the Office of Pandemic Preparedness and Response was in charge of H5 because it is a domestic outbreak, and they were focused on the domestic space. But we worked very closely together between the National Security Council and OPPR, as we called them. I mean, I think this is another, like the domestic global piece is challenging too, because the top priority for any administration is to protect the American people. And when you have a domestic crisis, you're, 150% focused on dealing with addressing that domestic crisis. But the challenge is, I mean, most immediately, our partners in other countries want answers, information. They want the same things that we want when we see a threat in another country is get this under control, share all the information quickly, tell us what you're doing to prepare so we know what we need to do to prepare. And I think, I do think that we tried very hard to be very forthcoming with information when we had it, but we do have this challenge of a federal system here in the United States, of 50 states that are independently governed and run and can make decisions about things like whether they're going to test their bulk milk for H5 and how they're going to manage farms and cows. And so, it's interesting to be in a position where you're kind of explaining the challenges of getting quick answers and responding quickly to outbreaks within your own country. And that's often what we hear from other countries when we're asking them to, move more quickly, contain the threat, building their capacity to contain the threat. So I think there are many countries that probably, and I think have reflected that the United States needs to, take care of what's happening at home, even as we give advice to what's happening around the world. But there is also just, the threat of H5 and avian influenza or just pandemic influenza is one that we and the rest of the world have been worried about for decades. So whether it's from this current outbreak or another outbreak originating somewhere else, it does seem like a very likely cause of the next pandemic whenever that happens. And so whatever we can do right now to exercise and prepare for that is probably in all of our best interests.
Absolutely. It sometimes in government, you're balancing multiple interests and tensions. So but let me see other questions here from the group. Don't be shy. We're open to anyone else enrolled in the class. I don't know how
Oh, I
many
have a
other. Oh,
question.
please. Yeah, no, I couldn't see your hand up there.
No,
I'm
I know it's
sorry. Please.
blending in. I'm kind of curious. I think a lot of us are looking for optimism after these past 3 weeks and kind of looking for like avenues for agency. And so I was wondering what kind of your take is on that. A lot of us are involved interning in government or interning at NGOs or like think tanks. So I think any kind of advice on how we can navigate these times would be great.
Yeah. Yeah, I mean, it's a really hard time. And I think, a lot of wonderful people who have been working for a long time in this space are being really deeply affected. And I think it's hard to see people who are, public servants for their whole careers. I think, made to feel like their work does not have value, which a lot of people are feeling right now. So it's really hard on just a personal level, but then, professionally looking at the space and what it means is challenging. I think, I had some conversations with a mentor of mine at the White House after the election, obviously before we saw what's unfolding now. And she said, you can make a choice about waking up every morning and looking at the news coverage and, feeling just dejected and worried and, hopeless about the news, or you can focus your eyes on the horizon and think about building what comes next. And I think it's hard to not do the former. I'm doing a lot of the former, to be very honest. But I do think the more we can all start to think about and focus on what do we rebuild from where we are here, and we will have a chance to rebuild. And even what opportunities can we see in that to rebuild things in a way that are better than the system that was here before. I think the world, even 5 years from now, the world is going to look so different from how it looks right now, probably in good ways and bad ways. So you guys all, I'm sure have a vision for what that needs to look like and, how it will look differently. I'm still catching up on how to use Zoom. So I think you all probably have ideas about how things should be different, even from how they were 3 weeks ago or a year ago. And I would say focus your energy and attention on building out that vision and imagining, what you would build from scratch. And then we get through the storm of this moment, we wait for the dust to settle, and then we start rebuilding because there's not another choice. There are people in this country and all over the world who need support. There's a lot of work to be done. There's going to be more and more crises from climate change, from humanitarian disasters that, we need to roll up our sleeves and keep doing the work. And I would say, also it's a marathon, not a sprint. If you get burned out and exhausted and give up, then that's also a win for people who are trying to tear down this work. So take care of yourselves.
Amen. Let's see any other comments? Oh, okay, Maeve?
Yeah, I'm just curious, when it comes to working in the public sphere, like, do you have any tips for just staying up to date? I feel like going to Georgetown, it is like a very political environment, so it's very easy to obviously hear about so much happening in the world, but even like post grad, not being surrounded by 6,000 other like young people, what is like the best way of staying in kind of like the know of what's happening within the health kind of world? And what are your tips for staying connected to everything that's going on?
Well, maybe don't stay too connected to everything that's going on first, but I mean, it's an interesting question. I would be interested in what you guys have to say because the media landscape has changed so much. It's really hard to figure out what the trusted sources are that are providing useful information. I would say find a few outlets or sources, whether it's individual people who you trust or, outlets that have useful information. I like to read the Stat News updates every day. They do, I think, a useful roundup of the latest news in both domestic health and some global health issues. Yeah, I think I also think we need, one of the realizations in this moment is that we're not, people who believe that we should be proactively engaged in the world believe that we have a responsibility to be supporting and working alongside people who don't have the resources the United States has. We have not made the case as effectively as we need to the American people about why this work is valuable and why we should invest in it. So I also think there's a need for more voices and more compelling ways to tell that story and more effective ways to tell that story. So hopefully you guys can figure that out. Also, like, I don't know how to get on TikTok. I don't really know how people communicate now. So maybe part of what you all can do is create content to get those stories out and tell the story more effectively so that 4 years from now, 3 years from now, we have a better story to tell about the importance of these investments, and it will help us build the work back up.
I would just add, in addition to the Stat News updates, and I can send you all the links, but, one of the readings you had for tonight was Think Global Health, which is a nice summary of relatively short opinion pieces by the Council on Foreign Relations. Johns Hopkins does a really nice job of a thing called Global Health Now, which is a relatively short daily email. And the last one is a place called KFF, it used to be called the Kaiser Family Foundation, and they do also lots of newsletters and aggregates. Just reading all that stuff can be overwhelming. So I guess my thought would be to pick a couple that you find. And the nice thing about having sources that at least I believe are reliable, of course, you have to make your own judgment about what's ultimately reliable from your perspective, but then you can figure out how to use that material day to day because you can be there's an ocean of data and information out there. It's too much. So
I
it's-
also would add, I think that there are a lot of really good long form pieces, The
Yeah.
Atlantic, New Yorker, Foreign Affairs. I think, not that you have to read it cover to cover, but I think if there are areas you're interested in, there's a lot about like the broader geopolitics of the moment, cultural moment, economic trends, technology trends that influence and affect in ways that are sometimes hard to understand the global health space. And so it can be really, I'm trying to do more of that, just reading long form pieces and doing kind of deeper thinking about some of these trends and thinking about how the field is changing in the coming years.
It's a great point. And again, these seem like old institutions I'm referring to, and they are. But CFR has some education tools where they've done a nice job of trying to collect some of the longer form pieces that Stephanie was referring to, not just about health, but people debating the strategic relationship, say, between the United States and China, which is defining, I think, well, at least in my view, at least, will define the near future, at least, of how power politics plays out on the global stage. And so, like, those are places where you can access longer form without having to read every issue of the Atlantic and Foreign Affairs. Other, oh, Jordan.
Yeah, so just kind of going back to the previous conversation, with tightening budgets and the shifting political priorities, what role should our other key partners like NGOs, multinational corporations, and other big investing countries play in ensuring stable funding, during this presidential term? And is it possible for one of these other countries to step up and fill this gap left by the US?
Yes, a lot of people have asked me that question in the last few days. The answer is, I think it's very unlikely. The United States is overwhelmingly the lead donor in almost every health issue, with a couple exceptions, pretty dramatically so. And I think the global trends are such that it's very unlikely to see any of the countries that have been traditional donors step up. I think the UK has just, they're scaling down their foreign assistance funding from 0.7% of GDP to 0.5% of GDP. So they're going to see likely additional cuts, and they're often the second largest donor to a lot of these issues. So that is a tough pill to swallow, but also why we were pursuing this conversation about sustainable financing and more diversified sources of financing. I think there's room for improvement in the multilateral development bank space, the international financial institutions, in terms of the ways that they engage with and work with countries to invest in global health. Countries then would take out loans that they would repay, but often with low interest rates that are priorities for those countries. So I think there's some space there. The DFC model is an interesting, I think, opportunity space, but it's not the same amount of money. I think the private, there's been a lot of discussion of the role of the private sector, especially coming out of COVID, because, they were so strongly affected by the COVID pandemic. I haven't seen a great model for bringing substantial private sector investment into the global health space. There are some smaller models, in the HIV/AIDS space, in pandemic preparedness, but it's not a lot of money relative to the effort needed to bring the money in. That's not to say that there isn't an opportunity there. I think there is. But there's not an easy, obvious solution in terms of filling the gaps. And then there's philanthropy. But I think philanthropies are understandably hesitant to start filling the gaps that have been left by governments, because they feel it's the responsibility of governments, and they don't want to be, holding the bag long term for a lot of these issues. So it's tough. It's a tough moment, and I think there's a need to put some very smart heads together and come up with a better way to do this.
See, any other questions? Yeah, please, Fritzy.
I was wondering if you could expand more. You talked about in your first job post grad having the moment of I have no idea what I'm doing and am feeling kind of enormous, I think you said, yeah, enormous amount of responsibility, and considering that the stakes are so high in health related work, how you kind of manage that doubt in a new role, and kind of where you found support in that moment.
Yeah. I mean, I think humility is very underrated in this world. And perhaps is not valued in an immediate sense in this country, but hopefully we'll get back there. I think a lot of people often don't have any idea what they're doing, even when they are in fairly senior roles and they're figuring it out. It doesn't mean that you're not smart or competent or capable of doing it, but sometimes I think just kind of acknowledging that and saying, I'm not actually sure what the right answer is here is a much more effective way to make progress. And sometimes, sometimes people don't want to hear that you don't know what you're doing, let's be honest. So you have to be careful about it. But I think the way that I mean, part of the way I managed it is that I sort of pivoted in my career. I felt like I don't feel comfortable working in a space where I'm going and looking in the eyes of a mother and telling her what she should do with her child. And so I need to either get to a place where I feel more confident that the answers I'm giving are the right answers, or I need to find myself in a different place in this space that feels like a more appropriate place for me to be. So that was really just, you have to kind of figure it out. You have to try some different roles and spaces and see what feels like the right space for you to be in. But I think for me, it was just sort of, this is not a role that I want to be playing or feel that I should be playing, but there are other people who are better equipped to play this role.
Excellent. I think that idea of figuring out where you're fit, there's lots of different things. As we all talked about a couple of weeks ago, there's no right or wrong way to do any number of things in this field or others. Part of this journey you're on is to figure out what it is you like to do, what it is you're good at, and where is life giving you opportunity? Lots of people who have skills like you do won't have the same opportunities you will. And just figure out that match. But let me see who else is. I don't see. Well, let me ask a final question if I could, Stephanie, and it kind of goes back to your thesis. In addition to what we've seen the last 3 weeks, and it is, I mean, it's crushing to see what's happened. I just to see how civil servants have been treated, to see how agencies have been treated, to see this process the administration is pursuing that it's sometimes hard to understand aside from being sort of a broad political move, and we'll see where the country ends up in this. But one of the things that is striking to me is the idea of human rights at its best, at least in my view, is grounded in a shared understanding that there is a way in which all countries should conduct themselves, at least on some basic minimum level. And I guess I'm wondering, and this may be an unfair question, but I'll ask it anyway. Looking back now 25 years, do you think we're moving in a direction where human rights is more central, or have we been moving backwards? And maybe not just the Trump administration, but just the world in general. I guess I'd love your take.
Yeah. I mean, I wish I had a more optimistic answer to that question. I don't think it's linear in either direction, but I do feel like we have lost ground globally. I mean, certainly in this country, but also globally in a lot of ways in recent years. And I think for me, one of the ways that was evidence to me when I was in government was working alongside people who have been, in multilateral negotiations for decades, who, were thinking about, can we revise and improve and update some human rights agreements, from 2 decades ago? And the answer from many of those people was, we shouldn't risk reopening it because we would lose ground. We can't get consensus globally on enshrining human rights right now. So that is really disappointing and frustrating. And I think, similar to how it feels in this country when you see us losing ground on basic rights. I think it's a really important moment for reflection, and that's a conversation I think we have been having of, we're losing ground. We're not winning the argument on international human rights in terms of expanding rights. And to be clear, the United States has not always been a constructive participant in those discussions, aside from who's in the White House. So I think we're right now not on a good trajectory globally, and it's very much connected to democracy, and I think the extent to which democracy is surviving and thriving in countries around the world, and the fact that authoritarian regimes don't want to have active civil societies. They don't want to protect and promote the human rights of marginalized populations in their communities. And therefore, there's a push in these international settings not to enshrine those human rights because it puts pressure on governments to also protect the human rights of groups that might disagree with their views. So I think all of these pieces are connected. I don't think we're going to be on a downward trend forever. I think things swing back and forth, but we're in a tough moment right now here and around the world. And, maybe it's just a moment of forced reflection.
Well, I think that's exactly forced reflection, and I hope it inspires people to action, because the truth is none of these ideas have gotten anywhere without people taking steps. So I have to admit, I never thought we'd have such fundamental discussions about democracy in the United States as we're about to have right now. On the other hand, these can be moments of change. Things move, things proceed as they are until they don't, and so we'll see. So, but before we do this, I wanted to ask everybody to join me in a virtual applause here for you for joining us for an hour and a half tonight. I hope everybody understands why I invited Dr. Psaki to join us, because she literally was like all of us, went to undergrad here at Georgetown, but also I think you've really found a fascinating path, and that led to the highest levels of government policymaking, but you've done fascinating work in other aspects of public health. And part of the purpose for these conversations that we have every couple of weeks is for our students to see exceptional people like you who've made their way and made a difference in the world and are still in the fight. And I think this semester's theme is going to be staying in the fight. So I appreciate everything you have done, and maybe even more what you're going to do. So thank you for being, thank you for making the time on a snowy night. And I'm sure everyone's happy that we're not walking through the snow at this point outside of Healy Hall. So thank you.
Thank you, John. Well, thank you for having me. It is a pleasure to meet all of you virtually. Hopefully I'll have a chance to meet some of you in person, but also welcome to the fight. It's going to be a long fight. We need more people in the fight in different ways. So I'm very glad to have met all of you.
All right. Well, everyone have a good evening. Enjoy the rest of the snow, and Stephanie, I'll see you soon. Okay.
Take care.
Take care, everybody. Bye-bye.